Hi, my name is Daniel Perez, and today in this video we are going to go over the appendicular skeletal structure. Alright, here we have the clavicle. The rough part is on the bottom, and the smooth part is on top. This is the sternum end, and this is the acromion end. So this would be a right clavicle. Right here we have the right scapular. This is the infraspinous fossa, the supraspinous fossa, subscapular fossa, and the glenoid fossa. This is the medial border, the lateral border, and the superior border. We have the superior angle and the inferior angle. We have the suprascapular notch. We have our spine, acromial process, and the coracoid process. Right here we have our right humerus. This is the head. Then we have the anatomical neck. We got the greater tubercle, the lesser tubercle, and in between we have the bicipital groove. We have our surgical neck, and then this little bump right here is our deltoid tuberosity. We have our medial epicondyle, our lateral epicondyle. We have our trochlea. We have the capitulum, the coronoid fossa, the radial fossa, and the olecranon fossa. Alright, right here we have the right radius. We have our head, the neck, the radial tuberosity, and then the styloid process. Right here we have the left ulna. This is the olecranon process, the coronoid process, the trochlear notch, the radial notch. We have the head and the styloid process. Right here we have our right hand. Starting with the carpals, we have the scaphoid, the lunate, the trichotrum, the pisiform, the trapezium, trapezoid, capitate, the hamate. Then the metacarpals are number 1, 2, 3, 4, and 5. This side is the base of the metacarpals, and this side is the head. Our phalanges, there is the proximal, the middle, and the distal. On the phalanges of digit number 1, there is only the proximal and the distal. There is no middle. And here we have the loose forms of the carpals. The pisiform looks like a P shape. The scaphoid has an S shape, and the hamate looks like a hammer. Alright, we have the left pelvic bone. There are 3 main parts to it: the ilium, the ischium, and the pubis. On the ilium, we have the anterior superior iliac spine, the anterior inferior iliac spine, the posterior superior iliac spine, and the posterior inferior iliac spine. We have the iliac crest, and then we have the iliac fossa. Down here we have the greater sciatic notch and the lesser sciatic notch. In between we have the ischial spine. Then down here we have the ischial tuberosity, the ischial ramus, On the pubis, we have the inferior ramus and the superior ramus. And then we have the pubis symphysis. We have the obturator foramen and the acetabulum. This is the left femur. This is the head, the neck, the greater trochanter, lesser trochanter. We have the intertrochantic crest, the intratrochantic line, the gluteal tuberosity. Then we got the linea aspera. On the bottom end, we have the medial epicondyle, the lateral epicondyle. Then we have the medial condyle, lateral condyle. In between, we have the intercondylar fossa. And on the front side, we have the patellar surface. Here we have a left tibia. This is the medial condyle, lateral condyle. In between is the intercondylar eminence. We have the tibial tuberosity, the anterior crest, and on the bottom we have the medial malleolus. We have the right fibula right here. This part right here is the head. This is the neck. This whole part is the shaft. And on the bottom we have the lateral malleolus. Here we have a patella. The top part is the base and the bottom part is the apex. And when you set it down, it will lean to one side. And depending on the side it leans, it tells you which side it is. So it leans to the left, making a left patella. Right here we have a right foot. Starting with the metacarpals, we have the calcaneus, the talus, the navicular, the cuboid, lateral cuneiform, intermediate cuneiform, and medial cuneiform. Moving down to the metatarsals, we have 1, 2, 3, 4, 5, labeled from medial to lateral. On this side, we have the base of the tarsals, and this side we have the head of the tarsals. For the phalanges, we have the proximal, the middle, and the distal. Only on digit number 1 we have a proximal and a distal. This curvature right here that goes across, that is the transverse arc. The arc right here is the medial arc, and the one on the outside of the foot is the lateral arc. Here we have loose tarsals. This is the talus. It's got the smooth top. And we have the calcaneus, which has the bump on the back, and the navicular, which looks like a boat.